Hi, I'm Dr. Shahariar Saikh, and I work for Mercyhealth based out of Mercyhealth Woodstock Medical Center. And I'm here to speak about diabetes, and the goal is to give some basic information about diabetes so that people can understand and come see their doctor and get a better care early in their disease processes so they can have better, longer, healthy life. Diabetes is a disease of the century, and we have millions of people worldwide who are experiencing diabetes and costing millions of dollars worth of healthcare cost. And me as a primary care physician in the front line to help with that disease processes so we can not only make people's health better but also cut the healthcare cost. So therefore, diabetes is a chronic, complex disease processes which needs lifelong medical care and requires shared decision making from the patient as well. There are two types of diabetes: type 1 diabetes, which is about 10% of the cases, and that's why you have no insulin production and you have to inject insulin. And there's type 2 diabetes, which is the one mainly it's causing complication, and majority of the patient, around 90% of the cases, where you have insulin which is not working well, therefore your pancreas is producing excessive amount of insulin initially, but later on when the pancreatic beta cell, which secretes insulin, burns off, then eventually you start producing less and less insulin. But the most important part is, if you do not have insulin, your blood sugar in the blood is high, and the blood sugar is a toxic to your body, and that toxicity can affect many parts of your health or many parts of your body. For instance, the high blood sugar can be toxic to the heart, causing heart disease, can be toxic to the kidney, causing kidney disease. It can be toxic to the eye, causing eye problem. It can be toxic to your nerve, causing nerve problem. It can be toxic to your foot, causing ulcers, numbness, as well as joint destruction. It can also cause effect in your brain, and you can have a stroke for uncontrolled diabetes. Okay. It's very simple for a person to come for a screening well health exam, and your doctor can check your blood sugar fasting, and if your blood sugar goes above certain level, i.e. over 126 in 2 different days, or random blood sugar of over 200 any given time, or if they can check another blood parameter called hemoglobin A1C, which is 3 months of average blood sugar, and if it is over 6.5, then you are automatically diagnosed diabetes. Now, the word diabetes doesn't mean a death sentence. According to 21st century medical guidelines, we can treat this effectively and minimize the complication with treatment and make people live longer and have good quality of life. Number one gold standard for diabetic treatment is very simple: diet, what kind of food you put in your mouth, and exercise. And diet and exercise can reduce and prevent, in times if you are pre-diabetic, diabetes by 58%. Medication will do the other part. I would strongly recommend that you go to your primary care, get a consultation with a diabetic nutrition specialist to find out what kind of food you should eat and what not. That can make a significant difference, and you can make a lifelong change in your eating habits. And exercise is very simple. They don't ask for much. It's 20 to 30 minutes, 5 days a week, mixing with aerobic exercise along with weightlifting. New study has shown mixing up your exercise can significantly reduce your blood sugar. Okay. Then the third thing will be medication. I would strongly recommend you consult your doctor for that, because medicine can start from simple oral medication to injection to insulin. So it all depends on your disease processes and how high your blood sugar level is. Or you can consult an endocrinologist. Another thing is you should immediately stop smoking, because the smoking and diabetes doesn't go together and it can cause further vascular damage. The fourth thing you need to do is you need to update yourself with some vaccination, like flu shot yearly, pneumonia shot once before 65, and then when you're 65 you may need another one. You also need to take a tetanus shot, a shingle shot, as well as hepatitis B is recommended. And these are those vaccinations given to diabetic patients, because diabetic patients are more prone to pneumonia and ended up in a hospital, more prone to shingles, more prone to flu, and have further complications. Along with the diabetes medication, you also need to take other medication which doesn't make sense to you, but you may need to protect yourself and decrease further complication, i.e. you may have to take a medication for blood pressure even though you are normal, but you can affect your kidney. To protect the kidney, you may have to take an additional blood pressure medicine. You may also have to take an additional aspirin to protect heart attack and a stroke, and you may have to take an additional cholesterol medicine to protect you from getting heart disease and eventually a heart attack.